Hi, I'm Victoria, co-organizer of Metabolic Health Summit 2022. I so appreciate you joining me today for this interview. Today, we're actually going to be talking about a very important topic, mental health. You know, it's estimated that more than 51 million US adults are currently living with a mental illness. In fact, it's the fifth leading cause of disability in our country. And I'm sure those numbers have actually gotten much worse over the course of the last 2 years due to the pandemic. It's a really big problem. And thankfully, there is a new emerging field called metabolic psychiatry that is expanding, but it's brand new. And there's a lot of work that needs to be done. And there's some really amazing people in this space that are doing just that. And today, I'm actually speaking with somebody who has personally walked through the deep challenges of mental illness, but has also taken that struggle and is turning it into something really incredible through brain health related research that we're going to dive into today. The person I'm interviewing, her name is Maria Edwards, and she actually found ketogenic metabolic therapy in 2016 following a diagnosis of bipolar disorder type 2. She's since taken that challenging time, like I said, and is doing some pretty incredible work. But before we dive into that, I want to let you know that we do get deep into her story. I want that to serve as a bit of a trigger warning before you dive into this interview with us. I also want to mention that if you know someone, or maybe yourself, if you're struggling emotionally, or you might be dealing with a mental health issue, there are ways and resources that can help. And I've linked those below. So please check out that link if you might be struggling. And also know that if you're thinking about implementing metabolic-based therapies for something like a mental health condition, it's super important that you work with your physician because the process is not a simple one. And we kind of dive into that today. So all that said, I'm so excited to introduce you to Maria Edwards today. She has literally made it her life's mission to spread awareness about mental health. And she, in my opinion, is an incredible example of hope from where she's been to where she is now, to where she wants to go on the research front. Maria is truly making a difference, and I'm thrilled to be introducing you to her today. Hi, Maria. Thank you so much for sitting down with me today to talk about you, talk about your work, and just your incredible story. It's just really important to get it out there in the world, and it takes a whole lot of courage to do so. So thank you so much for hopping on today.
Thank you so much for allowing me to come here. I mean, this is something that is very close to my heart. I have a passion for keto, but also a passion for mental illness awareness and just spreading the word and kind of give hope to people that are suffering with mental illness, that it doesn't have to end badly and you can have a life of meaning, even if you have a chronic illness. So that is really important to me. So thank you.
Yeah, you're an incredible example of taking something so challenging and now turning it into something that you're just become this like incredible advocate for mental health and just suicide awareness and all of these things, right? So I want to get into that today, and I want to kind of dive into your story, as comfortable as you are in what you're comfortable sharing publicly. Yeah. But this really started for you when you were a young teen, when you were about 13 years old. And it's been a long process in order to get an official diagnosis of where you are now. Share with us a little bit about that journey of, you know, when you first started realizing something was going on and, you know, now where you are now.
I mean, my mother had, you know, at that time, we didn't know what it was, but my mother had a lot of depressions, and we knew that. She took antidepressant medication. And when I was a very outgoing child, and when I was 13 in 8th grade, I suddenly started to feel very bad. It was a lot of stress in school, you know, the first boyfriend and whatever. And, you know, friends picking at you or whatever, some stressors. And I started to stay at home. My parents were doctors. They didn't know I was staying at home. They were at work. And after a couple of months, I've been kind of staying at home. They found out, and I was taken to a psychiatrist. And the psychiatrist, he did some line on a paper, and he said, like, normal people have mood swings like this, and you are like this. And then he gave me medication. And I was actually prescribed by my parents medication, antidepressive medication, for over 10 years.
Wow.
And then I've struggled with a lot of depression, self-hatred, had a lot of self-esteem issues when I was a teen, really struggled mentally, but didn't think, that something was wrong with me, more than, I was very sensitive and had this depressions. And then what happened in 2014 was that I started to do this diet to compete in fitness. And I started when all the other competitors were drained and tired, and they were really, when they were losing weight, I just got more and more euphoric and just didn't sleep and talked really fast and were very hyper in a way, but didn't think so much about it. A half a year went by, and I did my competition, and I started to get these mood swings and was very sensitive to light and sound. And it went very quickly. I could go from being very hyper and happy to extremely depressed and anxious and having all these physical symptoms and cognitive symptoms. And I thought it was a burnout because my life had been quite hectic. I had applied for university, and there was a lot of things going on in my life at that time. So, but I went to my doctor. I said to her, I think I'm burnt out. I think, I have stress. And she had actually worked with my mother previously. My mother was dead at the time. And she said, maybe you have bipolar disorder. And I've always been a little bit, afraid of conflict. I'm Swedish, so we are very diplomatic. So I didn't say it to her, but inside I felt like, I'm not mentally ill. What are you talking about? So I changed doctors. I thought that she was nuts, and that I wasn't.
Right. That's so difficult. I can't imagine to kind of go through that transition. It's it's unfortunate there's such a stigma around it, and there shouldn't be.
Yeah, and I didn't know what bipolar was at the time. I just thought that that's kind of a serious mental illness. What is bipolar? And she said, no, it's not. And she told me some stories, but what she did say was like, can you read about it? So I changed doctor. I couldn't let that go. I started read about it, and it was a little bit like I read, and then something was like, okay. And then I was, no, I'm not, that's not me. And then I went away from it. And then went back to it. And I did that back and forward. And then suddenly I just realized this fits with me. This fits with my life, everything. And then I started to actively try to get help because my depression was getting worse and worse. And I was getting suicidal, and other things happened in my private life that was kind of also worsening that. And then the doctors, the psychiatrist, I went to a new doctor who took me to a psychiatrist. First, I had to wait for many months, 5 months, to get to one. And then they just said to me, that's the problem with bipolar type 2, is that you don't have this you have this hypomania with a mild kind of mania. It's different in every person, but it's not like a full-blown mania where you lose awareness of reality or psychosis. So they were just like, no, you're just depressed, and so I actually had to go through 3 psychiatrists and become catatonic, extremely acutely suicidal for almost 1.5 years. And I had planned my suicide and was very close to take my life at one point. And I did not have any hope whatsoever. And then I got this appointment to my current psychiatrist. And I came in and I said, I've read this and this happened to me and this fits with me. And she just said straight away, yeah, you're bipolar type 2. There's no doubt. Wow. And then she said to me, the medication I can give you for this comes with a lot of side effects. And that gave me a lot of trust in her. So I was like, okay, I know that. I've read that. I'm really afraid of gaining weight and everything that can happen to you. And she just said, I have this. So she kind of said, you have lithium, you have antipsychotics, you have anti-epileptic medication. And then I could just say like, okay, what happens if I take this one? Oh, you lose your hair and you gain a lot of weight. And if you take this one, this will happen. And she put all the adverse effects first.
Right.
And then I said, okay, which one do you think I should start? And she said, this one. So we started with an antipsychotic medication. and it saved my life. Like in 3 days, my suicidal ideation, the thoughts and everything started to calm down. And so she saved my life.
Wow.
I would not have lasted. I was so close to not surviving that, because you're tormented in a way that only a severely depressed person can understand. All kind of joy and hope is taken away from you.
Yeah.
I could not move outside my apartment or my car. I could not live a life at all.
Oh my gosh, it's just completely shuts everything down. I can't even imagine the fact that you're still here talking today and I'm doing so much good in the world as a result of this. I mean, you're such an inspiration in so many ways. And I cannot imagine that that pivotal moment of finding a psychiatrist who's listening to you, who's being super transparent in the process. You get on this medication and things start to change. And it sounds like that was kind of like the moment where things started to improve. And then it led you to this place where you found ketogenic metabolic therapy. Explain that, of like where, how that kind of came into the picture and how that's been such a powerful, adjunct and just therapy for you in this whole process.
So I've always been interested in nutrition, but I've been very much like everybody else, searching, doing diets off and on and stuff like that. I have a very, very sensitive body. I don't have a lot of muscle mass. So I'm actually getting all the effects of a medication, but I'm also getting all the side effects. So I got every single side effect you could have. With muscle cramps, I gained 77, almost 80 pounds in a year from that medication. But then I have a friend, Shannon Yorton Penna, as you very well know, and she was very involved with me at this period, and she tried to help me, and she talked about the ketogenic diet. And I was a little bit, because I thought it was kind of like Atkins, and I had tried Atkins, but I didn't do enough fat. So I did more like a solely protein, low calorie diet. And that in the past had made me a little bit manic. So I was really afraid of doing something with a diet. But she said, try it. And I did try it. And she taught me a lot. And I started reading, because I have this curious mind. And I just found out that the immense cravings you get of antipsychotic medication, I think I would have gained 140 pounds if I was not on the ketogenic diet. I mean, you can overeat on a ketogenic diet, and I did. Otherwise, I wouldn't have gained so much weight. But because I removed the carbohydrates, I didn't have the same cravings as you are on antipsychotics. You can wake up during the night, don't remember what you're doing. You go to the fridge, you eat, you wake up in the morning, you don't remember a thing. It's very sedative and affects your body a lot. So I just started to doing keto. In the first 1 year, 1.5, I wasn't that consistent all the time. I was a little bit on and off. But then I just found out that if I had carbs, I would get extreme depressive symptoms. Just the day after, I would wake up, I would cry uncontrollably. I would feel so depressed, and my mind wasn't clear. And also because this medication is very sedative, and it's very hard to be on that medication, the alertness you get from the ketogenic diet is kind of contradicting a little bit the sedation of antipsychotics. So in a way, it made that I could study, I could get up in the morning. Otherwise, before keto, I think I slept 16 hours a day because of my medication. I couldn't get up until 1 p.m. or something, because I was so out of my medication. So it helped me to get a life. It helped my moods to get, more stable. And then, 1.5 years ago, I started with my psychiatrist to lower my dosage. I went to half of my dosage, and I was on that for a year. And then last summer in August, I said to her, I really want to try. I mean, I've been on keto now since 2016. I really want to try to be medicine free if I can do it. And we tapered the medication out, and now I've been medicine free for 8 months. And I mean, I do have bipolar symptoms sometimes. Bipolar for many women is very close to the menstrual cycle. So I do get depressive symptoms up to my menstruation and stuff like that. also if I'm stressed and I'm not, sleeping, I can get also a little bit hyper, but mostly my problems is the depression is my main symptom.
Yeah. Wow, that is pretty incredible. It's something you don't hear of, when somebody with bipolar disorder or any mental health condition that's on medication, being able to get off of it. But I mean, it really goes to show the potential of how powerful this is truly a therapy, and it can be. So it sounds like you really worked very closely with your psychiatrist, which I want to mention to those watching is really, really important, because obviously when you're dealing with something like this, as you mentioned, Maria, even just simply adding carbs back in creates this big shift. And it's super critical, I think, to work with a professional who knows what they're doing, who can dedicate the time to kind of transition. But how was that process like for you and your psychiatrist? Because metabolic psychiatry is such a brand new space. And we'll get into some of the research that you're now involved with, which is really, really exciting and so necessary to further this entire movement. But metabolic psychiatry is so new. So I'm sure this was something that your psychiatrist maybe she had heard about it and you guys kind of collaboratively worked together. But talk about that a little bit.
Yeah, well, she didn't. In that way, I also really recommend people to have their doctor involved, because like you said, it can affect the absorption of the medication. If you, depending on your symptoms, you can get manic. If you have psychotic problems, you can get psychotic. So somebody needs to up and down regulate the medication. And I could also feel with my medication that when I was in ketosis, I actually felt that I got more medication into me. So there's very important, but she didn't know anything. So I was unfortunately a little bit on bare ground, but I think that my relationship with my psychiatrist is a very close one. And she trusts me a lot. And I am one of the fortunate bipolar people that are very self-aware about my symptoms. So many people get into their very depressive symptoms or the manic symptoms. And when they're in their symptoms, they're not really aware of them until after an episode or something. I've always been very conscious, like almost like I've had an upper consciousness looking down at me saying that's a depressive thought, or you're thinking this because you're depressed, etc. So I just told her how I was doing, that I wanted to do this diet, and she really supported me. For me, I didn't have to do a lot of medical adjustments, but we talked about it. But I think also it depends on your illness, what kind of medication you're on, what dosage you're on, and so on. So, and then unfortunately, later I found a psychiatrist in Denmark that is actually offering Vibeke, that is actually offering this, and she is the only psychiatrist in the whole of Denmark, in another part of the country, who is offering this. But I did not know her at that point. And she's also taking people for free and guiding them. She's very much into this keto. But otherwise, I only know people abroad, like Georgia Eid and Chris Palmer and people like that, so there's not a lot. No,
there's not. No, it's like a handful, really. I mean, when we're talking about this, which it's gaining some really amazing momentum. And I think too, like being such a powerful patient advocate for yourself, right? So going in there and saying, hey, this is what I want to do. And having such an amazing psychiatrist who's like, yeah, let's do it. I trust you. Let's have this like collaborative relationship is so critical. So for any, physicians watching, this is such a powerful testament to, having that, patient physician relationship be very much a collaborative one. And you're just, proof of what can happen, where you can go with this, right? If you're open to that. And so your psychiatrist was open to the point where she helped you tailor off the medication. And what does she say about your progress now? Like you're off medication, you're doing really well. You still obviously are experiencing, you have symptoms, which, it sounded like you still had some symptoms on medication as well.
Oh, yeah. I actually think I have less symptoms now without the medication. But I think it's also, again, it's knowing your illness, it's knowing yourself, it's knowing what tricks you, what sets you off. I mean, with mental illness, as many chronic illness, it's not only nutrition, which is a huge part, but it's also stress reduction, sleep pattern, having good friends around you, not, being surrounded with good people, and stuff like that. So that's also kind of a part of your keeping stable package. But I'm actually in Denmark, you are only going to psychiatrist as long as you need actually treatment. And often you get like 12 appointments, and then you can get a new referral again if you need more. So I went to her, I think, couple of months ago, and she said, well, you're doing so well and you're not on medication, and there's kind of nothing we can do. So right now I'm actually not at my psychiatrist, but it's always like, if something happened in your life, if you become pregnant, I want to see you again. If you get some other symptoms, if you get some worsening, if you, like, normally in bipolar and depression, they say, like, if your depressive symptoms is over 14 days, it's an episode. So if you do have everyday depressive symptoms for 14 days, you should actually go and see your psychiatrist again. So right now I have her, but I don't see her at the moment.
And you haven't had any sort of like episode? You've
been
okay.
No, so it's more like symptoms. I mean, I did have maybe like a month ago, and I don't know if it was stress, it was hormonal, I don't know what it was, but suddenly I had this week of very depressive symptoms of 5-6 days, and my self-esteem was really low. I had something, it reflected on my relationship with my boyfriend, because I felt that he didn't like me, that I didn't look good enough, all kinds of insecurities. And I have this awareness that I can say to him, I do feel really depressed, and I just feel all the things. And the very horrible thing for me, many people that get depressive symptoms, is I feel very, very isolated and detached with people I love. So from one day to another, I can feel completely detached from my boyfriend, from my girlfriends. I don't feel that my work matters. I don't feel any joy. I don't feel anything. I just feel like crying. And I also can differentiate between when I have bipolar symptoms. So I feel sick in a way. It's kind of feeling like having a flu in your mind. And when I feel sad because of natural circumstances, like you had a fight or something happen in your life. And those are a little bit different feelings.
Right. Yeah. No, I mean, it makes sense what you're saying, and just more sort of symptoms, like kind of shifts versus full blown, episodes like you've had previously. Previously. It's pretty incredible to hear like how much progress you've made over this. And I'm sure, ketogenic metabolic therapy has obviously been a huge piece to this, but as you know, and you kind of briefly touched on, there are a lot of lifestyle factors that are super critical in maintaining and caring for our mental health. If you want to explain maybe what, in addition to food, has been so powerful for you in kind of, continuing to make progress.
I think that one thing that I still struggle with a lot is work-life balance. I mean, I'm very passionate. I'm often complimented on that I have a drive that is exceptional. I just go if I want something or if I have a goal. But I also can lose myself very much in what I'm doing. So right now I'm in the beginning of my research career. I'm doing everything to network, to say yes to all kind of projects. And that is something one needs to be very aware of, especially if you have bipolar disorder, because you go, and then just suddenly you stop, you don't have the energy anymore. So that is really important to kind of shut your mind off. And I'm really trying to do this with meditation, exercise. I've been really bad at exercise, and this is also a thing you need to prioritize, even if you're busy, to take care of yourself, because I have a very overactive mind and I can ruminate. And when I go to bed, often I think about projects and meetings and what should I say and why didn't I say this and what's going to happen in the future. And I go through things and I can't sleep for like 2 hours or 3 hours because my mind is just wound up. So sleep is really important. to winding down, meditate, movement, and again, having supportive people around you, like your friends that can say to you, oh, Maria, it's going a little bit fast right now. Are you taking on too much? Or are you okay? You seem a little bit depressed. Are you okay? Like somebody who knows you and knows that you are ill, they can kind of pinpoint you and say, maybe you should calm down a little bit, or, without you being hurt, somebody who can be honest, because you need that,
Totally. No, you've brought up some really important points that it's so easy for everyone to kind of forget about. I mean, especially too, like, it's been such a tumultuous, challenging time for everyone, right? And it's even more so difficult or easy to kind of fall into that, like, difficult work-life balance, not being around friends, all of those things. So you bring up some really amazing points in that regard. And you also briefly touched on your research work, which is so exciting. Since going on ketogenic metabolic therapy, you've been able to get your master's. You've actually, your master's thesis was entirely around feasibility of a ketogenic diet in severe brain injury. Talk about now where you've headed. You've come from this super challenging place. I mean, I can't imagine what you've gone through since you were a kid, really. And you've taken that experience and you're turning it into something that is helping and going to continue to help so many people that are maybe also struggling from something like what you have, or even PTSD, traumatic brain injury. Talk more about your exciting research and where you want to go with this.
Yeah, well, I do believe in keto very much. And I know as a keto researcher, I'm very biased, and this is maybe not a good thing in science, but I know that a lot of scientists also who work in keto, really believe in keto. And I got the opportunity. It was a little bit like, because my professor had some contacts at the hospital with brain injuries. So I just said to him, I want to do something keto. And he had this contact. We had a meeting with them, and they were really positive. And I did this feasibility study, which was the first in the world, in subacute brain injury. So it was patients that are 3-4 weeks out of their injury. It was traumatic brain injury, but it was also stroke and several, severe brain injury. And I gave them a ketogenic diet for 6 weeks. They were like enteral feedings, but also ketogenic meals that when they got better, they are often semi-conscious when they come to that clinic. So when they started to wake up and be able to eat, they got food as well. And this was a big challenge to get the kitchen to cook ketogenic meals and everything. So I did that study, and hopefully it will be published soon. I still work on the last little bit of data. So I would like to do further research in brain injury, because there has been 4 studies in the acute, the totally acute brain injury, and only this study. So there's only 5 studies right now that I know of. But my goal is to work with ketogenic therapy. So for me, the patient group is less important than the therapy. So I believe that ketogenic diet can be used in psychiatry, in cancer and everything. So I've been invited to the National Hospital in the next couple of weeks to do some presentations about doing a study in cancer, and also doing a study maybe in bipolar or in the psychiatric hospital. And we are actually currently just starting to include patients soon, I hope, in Oslo, in Norway, where I'm supervising this master thesis project also with a student who is giving the ketogenic diet to PTSD patients. Wow. So there's a lot of projects, going on, and everything is keto.
No, that's amazing. And across so many different areas, right? And I think this work needs to happen. And the fact that, you're taking your sort of patient experience, and you understand better than anyone how powerful this potential therapy can be for yourself. You're one person, but you're starting to see more psychiatrists kind of, hop onto the fact that nutrition can play a role, especially alongside current standard of care, right? Even in potentially improving the efficacy of some of the drugs that maybe these people are on, or what have you. So That's really exciting to hear more about where you're headed and what you've been able to accomplish since fully coming off your medication through using this yourself. I mean, you know, in going through what you've been through and having these multiple perspectives now, you've got, you know, knowing what it's like to be in a really honestly dark place with this, but also knowing what it's like to find some hope, to work with a psychiatrist who hears you and wants to collaborate with you, to, you know, implementing nutrition as a tool in your toolbox, knowing all of this, having this broad, you know, spectrum of experience. Where do you see this field has to go? What is your vision for the future of this field of metabolic therapy, or metabolic therapy and metabolic psychiatry specifically?
I mean, I think it is really, really important to do a lot of clinical studies, because there are quite some animal data, depending on what diagnosis you look at. There's a lot of hypothesis, but I mean, I do feel a lot of hesitation from the doctors and from the hospitals, because first of all, nutrition is not taught in medicine anywhere. So it's only like registered dietitians who does that, and they're not all of them are into research. Many are just kind of working with the current recommendations. Right. And I think it's really important. I mean, I really want to advocate to you have to go the scientific way. You know, you have to do pilots and feasibility studies, you have to do controlled trials, but I really want to do randomized controlled trials that are big enough for the health, you know, the hospitals and everything to say, okay, there might be something here. Because I think that the nutrition that we are giving to the patients, even if it's enteral product or if it's the meals that we give to them, are very, very, very poor in many, many places. And they're full of sugar. And I think that we know now when everybody needs good nutrition, but if you're sick in any way, you need even more nutrition. So I would like this therapy to be available for patients. And then I think it is very important, of course, for the patients to be able to choose it if they want. And there's always going to be this with compliance when you have a specific kind of lifestyle change. But then you can maybe also do something with exogenous ketones. And so there's many things. I think that the whole healthcare system needs to be focused on food. No matter if it's keto or if it's only looking at vitamin D status for COVID or whatever it is, it needs to be focused on nutrition and how nutrition is the most powerful tool to heal, also to make you sick, but also to heal.
Right. Yeah, you're making a really important statement there. I think that it, at the very least, needs to be a part of the conversation, you know, sort of like upon diagnosis of many things, really, where you're saying, okay, well, what are you eating? Let's talk about that. And it's hard. It's hard to just the way that things are sort of built right now. That's maybe not an option mass scale, but there are ways we can get there. And like what you said, science, evidence, all of that is critical in sort of laying the foundation to, you know, bring the medical and science communities into that conversation to further spread it. Right. So you're really doing the work to be able to get us into that next step. And I just can't say it enough. Like, thank you for sharing your story. I can't imagine how difficult it is to go through what you've been through, but then also to have the courage enough to speak about it. And I know that there are so many other people out there hearing your story, learning about it. And, you know, you represent hope for a lot of people. So thank you again for speaking about it, because it's really important.
Yeah, I mean, that it gives my life meaning, to be able to give hope, because I think that when we look at people on social media, and if people look at me, they don't know I'm bipolar, you know, now I'm, you know, have makeup on and lipstick and I have a good job and I'm starting in my career, and people sitting there maybe being really depressed and suicidal and thinking, you know, she has it all or whatever, I can't do that. I think what I would have needed at that point when I was so sick was that all of my friends and people surrounding me, they loved me, they tried to support me, but none of them had experienced something that was even close to what I was experiencing. So I think if I had somebody at that point that was bipolar or had some other mental illness and said, I've been there and I came out on the other side, even though depression is a very strong, you might not believe it at that point, some part of you is like, okay, this person tried to kill themselves, this person did this person was so suicidal, and now this person is living a meaningful life. And a meaningful life is different for everybody. It doesn't mean that you have to do a degree or academic career or career. Some people with an illness cannot work. Some people are on disability pension or whatever. It doesn't matter, because you can have a meaningful life. A meaningful life means that you are stable enough to have good relationships with yourself and with your family. If that means that you can work or not, what's you want, the person. And I think what you said also within psychiatry, I think it's really important within psychiatry that one does not look down on the patient. I think that there is a stigma with mental illness patients. I've heard about doctors and nurses sitting and kind of talking badly about, I don't know if this is about patient. And there's this, the first psychiatrist I met was this like, take this medication, don't ask questions. I'm the doctor, just take this medication. And I had a lot of questions, and I was afraid of gaining weight and everything. And I was like, and my psychiatrist, unfortunately, I think is maybe not one of a kind, but very rare. And I think that the patients themselves, but also the system, need to encourage these patients to give them the power back, because it's so easily in psychiatry to, get a stamp and then you're just, I'm mentally ill. I can't do anything. My doctor just tells me to take pills and they give me all these side effects. And now I've gained 100 pounds and I don't like my body anymore. I'm even more depressed. I can't do anything about it. I'm so tired all the time. It's a vicious cycle. I think that the hospitals, the doctors and nurses need to give the power to the patient and say, you can do something. You maybe will always hear voices or have depressions or have this thought, but you can do a lot. And we're going to help you. We're going to help you and teach you and guide you and things like that. And that, I think, is missing. And that needs to be implemented in psychiatry, I think.
Yeah, empowering the patient and encouraging them to be an advocate, as you bravely did within your own story. It's such a difficult time. I mean, it's pretty amazing, the sheer strength that you had to be able to still fight and go to your psychiatrist and say, hey, like, this is my last, this is where I'm at. Like, we got to figure something out. I mean, that, I think putting power into the patient's hands goes, I mean, you're an amazing example of what can happen when you stand up for yourself and you keep fighting. And, Maria, I can't say enough just how grateful I am for you, your story, you sharing your work. We're so excited at Metabolic Health Summit to follow along with what you do in this space. I know how passionate and amazing of a human you are, of where you've come from and where you're going, that you're going to really do so much good in this space. So thank you for that. And thank you so much for hopping on with me today and having this discussion. I really appreciate it.
I am so grateful. I'm just so grateful to be able to just be on this platform. And I love talking about research, of course, but for me, the most important thing is to be an advocate for mental illness patients and for people who are suffering from suicidal thoughts and stuff like that. I just want to give them hope. And this is an amazing platform. It's the best conference ever. And I mean, I'm really happy that I'm allowed to share this on here. So thank you so much.
Oh, thank you. And, for all of you watching, definitely check out, head on over to metabolichealthsummit.com for more information on what we have coming up at the conference around mental health. And Maria, where can people find you and more information or any resources you'd like to share?
Well, I do have a LinkedIn. I have my Facebook. I have Instagram. people are always welcome to write to me, and whatever, if it's an email or a private message on Instagram. So I'm very much on social media, and so people are just welcome to reach out.
Awesome. Well, thank you all for joining us today. Thank you, Maria, for sitting down with me, and we'll see you all soon. Thanks so much. All right.